Okay, now we're on to the cranial nerves, and right now we're just going to have a brief overview. We're going to go through all the 12 pairs of cranial nerves, their names, their brief functions. Okay, and then perhaps if there's a need, we could go into each of them more in detail, and we could also go into a brief study on testing of cranial nerves. Okay, so let's begin. Now, um, to start, we have to first draw the brain, okay, and deep inside the brain, you have the midbrain, you have the pons, okay, you have the medulla. The medulla have pyramids here, olives, and then you have your inferior cerebellar peduncle, middle cerebellar peduncle, superior cerebellar peduncle, and of course you have your cerebellum here. Okay, and after your medulla, okay, after your medulla, you have your spinal cord. Okay, so there we go. Now, on to your cranial nerves. Okay, so you, your brain, your cerebrum has two cranial nerves, your midbrain has two, your pons has four, and your medulla has another four. So a total of 12. And they are paired. So you have 12 pairs of cranial nerves. Now let's dig into that. Um, in your cerebrum, you have two. One, the very first one is looks like a bulb just beneath your frontal lobe. That is your olfactory. Second, also inferior to your frontal lobe, but a bit more freer, is your optic nerve. Okay, that's two already. Now, in your midbrain, you have two. You have your oculomotor and your stupid nerve who goes at the back and exits in the front anyway. Another two. So that's four cranial nerves already. Now you have four in the pons. You have one big nerve here. That's your trigeminal. And then you have 6, 7, and 8. Just in the junction or located between the junction of your pons and medulla. And lastly, you have your nerves at the cranial nerves at the medulla. Now, again, between your pyramids and your olives, you have three, 9, 10, 11. And between your olives and inferior cerebellar peduncle here, you have 12. So, you have 1, 2, 3, 4, 5, 6, 7, 8, and then 9, 10, 11, 12. So, in just a short while, you have already drawn the cranial nerves and where they are located and where they emerge. Basically, they all go anteriorly. Anyway, it is a very bad looking face, but let's continue. Okay, so there are many mnemonics. Okay, most people, it is shown that most people remember the green mnemonics rather more readily than the non-green mnemonics. But anyway, you could easily search for mnemonics. Um, I'll try not to give you anyone because any mnemonic because what we were taught were the green ones. But anyway, let's go first to their respective names. Okay, so there's a mnemonic that goes like this: O O O, to touch and feel a toot toot, heaven. Okay, so naturally just with the censored um, bleeps there, it's a green um, mnemonic. And so you have your olfactory, you have your optic, you have your oculomotor. Number 4 is your trochlear. 5 is your trigeminal. Abducens. Number 6, facial. 8 is auditory. Of course, it has another name called your vestibulocochlear. And this is more descriptive of the function. But anyway, number 9 is glossopharyngeal. 10 is your vagus, your wandering nerve. Of course, your stupid nerve is trochlear. Number 11 is your spinal accessory nerve. Okay. And number 12 is your hypoglossal nerve. Okay. So you have 12. Now let's go to their basic functions. Basically, we need to know if that cranial nerve is pure sensory, pure motor, or both, or mixed. Okay? So there's another mnemonic there. Again, there are green mnemonics and there are non-green mnemonics. So let's go through that. Some say marry money, but my brother say toot toot make more. Okay, so olfactory is pure sensory, optic the same, pure motor, oculomotor, and trochlear. Trigeminal is mixed or both. Abducens is pure motor. Facial is both. Auditory, pure sensory. Glossopharyngeal is mixed, as well as your vagus. Spinal accessory, that's the one innervating your trapezius, so it's pure motor. And hypoglossal, your tongue nerve, also pure motor. So there's a lot of pure motor nerves and only 3 purely sensory nerves. Okay, so with that done, let's go to a brief rundown of their functions. Okay, so number 1 is your olfactory. Basically, it's got to do with the sense of smell. Okay, since it is, well, smell is also slightly related to your sense of taste. So these two go together. If you smell something, you're prepared to taste something. Okay, sometimes you could confuse your brain by letting your olfactory nerve smell something and letting you chew on something else. But anyway, it's all about smelling, and this is the nerve that is nearest to the brain. Adaptation is very fast. What does adaptation, or there's another term there, where you rapidly adapt or accommodate to the current situation. For example, you get into a room and you smell some strong scent, or let's say somebody farted in the room just before you went in, and so the smell, the malodorous scent is really bad. But after a few minutes, it's not so bad after all. Your olfactory nerve basically sort of adapted. Okay, you went into the room, somebody used rubber cement, so it smelled like rugby cement. But after a few minutes, it doesn't smell so bad after all. So that's how your nerve, your sense of smell accommodates. Okay, number 2 is your optic. Again, very easy. Vision. Well, easy in a way, but it's vision is actually very, very complicated. But anyway, just for the sake of discussion, your optic nerve has got to do with your sense of vision, light perception, how you distinguish faces or objects or visual acuity. Okay. Now, number three, we're going to talk about this more. Three, four, and six. Okay. Three, four, and six, we are going to talk about them because these are responsible for your extraocular muscles. Now, these are muscles around the eye, and these are actually very, very important. Imagine having a camera but no way to control it. Okay? You see something, you focus on it, you want to see it closely, you focus on it. That alone is a very, very complicated thing to do. And these extraocular muscles help you to do that. Okay, your sense of vision is not so very helpful without these extraocular muscles. Now, you will find a lot of drawings or illustrations about your extraocular eye movements. Let's say this eye hasn't slept for a while. Anyway, now your extraocular, they're called extraocular because they are the muscles that are outside the eyeball and they make your eyeballs move. Okay? When you say intraocular eye muscles, these are the muscles that control your pupils. Remember, if it's really bright, your pupils constrict, become smaller. If it's dark, your eye wants to take in a lot of light, so your pupils dilate. Those are intraocular. Okay, so we're talking about extraocular for now. Now, basically, you can divide them. Again, if you really want to learn about extraocular eye movements, it's not as simple as you think. But again, given enough time, it's not exactly hard. It's complicated. It's a bit complicated and it will take time. If you really want to learn, it's not so hard. I can give you some very good texts that make things easy. But then again, you have to admire the degree of engineering that goes to these movements. Now, let's go to your extraocular eye muscles. The ones that turn your eyeballs up would be your rectus, okay? Superior rectus muscles, okay? That's your SR. If you want to turn your or look down, that would be inferior rectus muscles, okay? Now, if you want to look towards your nose, that's your medial rectus, okay? And if you want to look out, that would be your lateral rectus, okay? Now, there's another type called your oblique muscles, okay? Your oblique muscles now sort of complement either your superior or inferior rectus and medial or lateral rectus, okay? So if you want to look up and or if you want to look up, actually the two muscles helping itself together would be your superior rectus and inferior oblique. Now remember, take note, it's a bit in reverse. Look up, it's inferior oblique, okay? And if you want to look down, your inferior rectus and superior obliques help out. Okay? So if you want to look down and to the side, what muscles contract? Your lateral rectus and superior oblique on this eye. How about on this eye? Your medial rectus and inferior rectus. Okay? So these, well, actually, if you look at your eye or extraocular eye movements, it's not so hard if you draw. Okay? If you just draw this diagram, no matter, I mean, the question could turn your brain into topsy-turvy, but if you draw this diagram, you won't get confused. Now you see the value of being able to draw. Okay? So, that is your extraocular eye muscles. Now, function. Just remember this code. Just remember this code. SO4, basically that's sulfate. Okay? Remember your chemistry. SO4, LR6. Okay? So, superior oblique is cranial nerve 4. Lateral rectus, cranial nerve 6. What about cranial nerve 3? All the rest. The ones that are not innervated by 4 and 6 are innervated by cranial nerve 3. Okay, that would include your inferior rectus, superior rectus, medial rectus. Okay, and inferior oblique. So, you don't have to memorize this, just know by heart SO4, LR6. Okay? That's the method of remembering things. If there's a lot of things to remember, just remember the exceptions. Okay, let's proceed. Where are we now? 1, 2, 3, 4, 6. Now let's go to your 5. 5 is your trigeminal. Now, your trigeminal is a very important cranial nerve. Okay? Let's draw a face if we can. Okay. I hope that's enough. Now, so that's your face. Okay, eyebrow. Now, your trigeminal is very, very important. It is a mixed nerve. If you look at the drawing, it has a very big nerve with 3 major branches, and then you have a smaller one like that coming out of the middle of your pons. The really big one is sensory and the smaller one is muscle. Now remember, your trigeminal basically is responsible for the sensation of your uh, face, entire face. Okay, so your sensory component, let's go to your sensory component. First, you have your ophthalmic, you have your maxillary, and you have your mandibular branches. Okay, so just remember, it's like your, just remember your medieval helmet. Okay, your medieval helmet looks like this. There, looks like that. Okay, so your ophthalmic basically is like this. Okay, it's responsible for innervation or sensory innervation of this area. That includes your forehead, your eyebrows, even the cornea of your eyes. When somebody sticks or touches your cornea with a piece of cotton and you blink, the sensation of something, if something gets into your eye, the reason why you detected that is because of your ophthalmic division. Okay, now next would be your maxillary division, and your maxillary division is somewhere something like this, upper lip there. So that's your maxillary division. Your cheekbones, your upper lip, okay, that's your maxillary division. And of course, you have your mandibular. Your mandibular is this part. Okay? So that's very important. That's why your trigeminal nerve is really big, because it subserves the entire face. Now, you might ask, how about this one, the ear? Well, basically, the ear is cranial nerve 7, facial, a little bit of cranial nerve 9 as well. Okay, so, oh, by the way, I forgot something. I just want to apologize to your cranial nerve 3. Aside from extraocular muscle, cranial nerve 3 also subserves your pupils. Okay, it's the one responsible for pupillary constriction and dilatation. And another thing is eyelid. Now we'll talk about the eyelid later on in conjunction with your facial nerve. Just remember that for a while. Now, how about your motor component of your trigeminal nerve? What is it responsible for? Remember, mastication. When you chew on something, okay, so your masseters, your muscles responsible for chewing, that's via your trigeminal motor division. Okay, now we're done with that. Let's go to your cranial nerve. Well, we're done with cranial nerve 6. Let's go to your 7. Okay, 7 is your facial. Okay, so your facial, you might think that the sensation of your face is due to your facial nerve. No, it's your trigeminal. So what does your facial nerve do? Again, it is a very important nerve, nothing to be trifled with. So let's go to the next slide. Okay, let's talk about your facial. Now your facial nerve is not, I don't know if this works though. Anyway, your facial nerve is responsible, it's a mixed nerve, yes. It's responsible for mainly motor, muscles of facial expression. Okay, so if you get angry, if you get happy, if you smile, if you laugh, if you try to blow something, if you purse your lips, if you draw back your lips in a snarl, that's facial nerve. And there's another thing that you should remember. It's some sort of a mnemonic. The facial nerve, if you're angry or if you're sad, it makes you cry. Actually, it's because it's also responsible for your lacrimation, tears, your tear ducts or your tear glands. If you shed tears, that's your facial nerve. Okay? And if you're angry, you spit. Basically, salivation. Your salivary glands. You have several salivary glands. You have your parotids, you have your sublinguals, you have many other salivary glands. If you salivate, now just picture a green mango. It's very sour. Imagine tasting it right now. So you basically are now salivating. That's the function of your facial nerve. Okay? So, if you're sad, you show the facial expression of sadness. that's facial nerve. You also cry, that's lacrimation, again facial nerve. You're so angry, you have your angry face there. You're so angry, you spit at your opponent, salivation, that's basically facial nerve function as well. Now, sensory wise, I've already mentioned it before, areas in your external ear. Okay, if your mom twists your external ear, you feel the pain. That's basically due to your facial sensory component. Of course, some of you will get angry, and some of you will cry, lacrimation, again facial nerve. Some of you will get angry and spit at your mom, which is a very, very bad idea. You get beaten up that way. Now, again, that's facial nerve. Now, another thing that you should remember, I should not have used red for the face, tongue. Okay? You're so angry, you stick out your tongue. Now, your tongue is all muscle, but it is also a very, very sensitive organ. Not only to touch, pressure, and everything else, taste. Okay? The sensation of taste. Anterior two-thirds. Anterior two-thirds is facial. Okay? Anterior two-thirds of the tongue, facial. Of course, if you look at your guyton, you have areas where you could feel sweetness, bitterness, saltiness, and whatever else. But anterior two-thirds is or anterior two-thirds sensory of your tongue is due to your facial nerve. How about your posterior two-thirds? It is due to your glossopharyngeal, cranial nerve 9. Okay? So these are the combos that you need to remember. Another good combo that you need to remember is cranial nerve 7 and 3. That's got to do with your eyelid. Okay? So, some of you have droopy eyelids. Okay? While others are really up like that. Now, your eyelids open and close. The muscles that open are innervated by a different cranial nerves. The eyelid muscles that close are also innervated by another cranial nerve. Now, here's what you should remember. Picture a pillar that props up the eyelid, or that keeps the eye open. That's cranial nerve 3. So basically, your cranial nerve 3 opens. Okay? Now picture a hook that closes the eyelid. So that's your cranial nerve 7. The hook. So what closes your eyelid? It's 7. What opens your eyelid? It's your oculomotor. Okay? So, if you see a person and you tell them, close your eyes. So he only did this. He could not close, let's say, the right eye. What seems to be the problem? What is weak? What is weak is the muscle that closes the eye. And what cranial nerve is affected? It's cranial nerve 7. Let's say you see a person who just woke up. Okay, still looks sleepy looking, and you tell them, wake up, open your eyes. And the patient did this. Again, right side is the problem. And your problem is your eyelids or the muscles that open your eyelids are actually weak. They cannot open it actively. Cranial nerve 3. Okay? So, We're almost done. Hang on. So where are we now? 7, 8. Your 8 is auditory or vestibulo-cochlear. It's a pure sensory, but number one, it has your vestibular component. Your vestibular component is a sensor in your inner ear that is mainly for balance and equilibrium. So if there's something wrong with that, you will have vertigo. It would seem that your surrounding is spinning. And your cochlear component, that's your cochlea, it's basically for auditory. Auditory. Okay? For detection of sound, recognition of voice. Okay? So sound, auditory impulses. Of course, this auditory impulse will go to your, some of it will be routed to your inferior colliculi in your midbrain, remember, and then to your auditory cortex. If it's language, it's going to be routed to your vernix area, sensory speech. Okay, so basically that's it, vestibulocochlear. Number 9, your glossopharyngeal. Again, we've already discussed that. Remember, you have your parts of your external ear, posterior 1/3 of your tongue, okay, and swallowing. It pairs with your 10, your vagus, okay, swallowing. And it is also solely responsible for your larynx. Okay, so your laryngeal nerve, that's your glossopharyngeal. So if you have a problem with your vocal cords, that's your glossopharyngeal. Number 9. Number 10 is your vagus. We call your vagus your wandering nerve. And it's called your wandering nerve because it goes almost everywhere. Not only is it it works with your um, uh, glossopharyngeal for swallowing. Um, so you have also, it also goes as far down as your esophagus, your stomach, your intestines, so remember, we have your autonomic nervous system. You have your sympathetic and your parasympathetic. Remember that your vagus nerve is a very important parasympathetic cranial nerve. Okay? Speaking of which, your parasympathetics have a lot of sympathizers in the cranial nerves. Just remember, whereas your sympathetics, they don't have anybody in the cranial nerve family rooting for them. In your parasympathetics, remember 1973. Why? Because the nerves that are included in your parasympathetic cranial nerve family would be your cranial nerve 9, cranial nerve 10, cranial nerve 7, and cranial nerve 3. 9, 10, 7, 3. 1973. So remember that. Okay. We'll talk about your vagus later on. But just safe to say, it goes to a lot of places. No? Esophagus, stomach, a lot. Now, 11 is your spinal accessory. Very simple. Some would even say it's a continuation of your spinal cord, motor nucleus. It basically, um, pure motor innervates your trapezius. And that's it. Okay? Last would be your hypoglossal. Hypoglossal, by the simple term glossa, that's your tongue. Okay? So it is the motor component of your tongue. The sensation of your tongue, anterior 2/3 is your facial, posterior 1/3 is your glossopharyngeal, but the motor component of your tongue is your hypoglossal. So stick out your tongue, that's hypoglossal. Turn your tongue to one side and then to the other, that's your hypoglossal. Make your tongue twist or turn into a tube, that's your hypoglossal. Okay, so if you have somebody who you say, okay, stick out your tongue straight out. If they can do that, that's your hypoglossal. Basically, your hypoglossal pushes out your tongue like so. So if you have somebody and you say, stick out your tongue straight, and he just did that. No, 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 I mean, let your tongue out straight. And he said, I can always do this. So basically, what you have is a strong hypoglossal on one side and a weak hypoglossal innervation on the other side. That's why. So basically, your tongue points to the side that is weak. But anyway, we'll discuss more of that when we go to testing your cranial nerve system. So for now, thank you. I thought this would last just 10-15 minutes, but now we're twice that. So I'll see you on the next video. Thank you.